AI and automation in payer operations, the big shift reshaping healthcare administration. Hello and welcome. In today's healthcare system, payers are under pressure from every direction. Members expect faster service, providers want cleaner approvals and payments, regulators demand transparency, and internal teams are asked to do more with less. This is where artificial intelligence and automation are becoming more than technology buzzwords. They are becoming operating tools that can reshape how health plans manage claims, enrollment, prior authorization, risk adjustment, fraud detection, member support, and provider collaboration. Pay operations have always depended on complex workflows. A single member interaction can touch eligibility, benefits, authorizations, claims, contracts, coding rules, clinical policies, payment systems, appeals, and compliance requirements. Many of these processes still rely on manual review, fragmented data, legacy platforms, spreadsheets, call centers, and repeated handoffs. AI and automation offer a way to reduce friction, but only when they are applied carefully, governed responsibly, and designed around real business problems. The biggest opportunity is not simply replacing people with machines. The bigger opportunity is improving decision support, reducing administrative waste, and helping staff focus on work that requires judgment, empathy, and expertise. Automation can handle repetitive tasks. AI can classify documents, detect patterns, summarize records, predict risk, and assist with complex decisions. Together, they can make payer operations faster, more consistent, and more responsive. Claims processing is one of the most important use cases. Payers receive large volumes of claims every day, and each claim must be checked for eligibility, benefits, coding accuracy, contract terms, duplicate billing, medical policy rules, and potential errors. Automation can validate routine claims, route exceptions, identify missing information, and reduce manual touches. AI can help detect unusual billing patterns, compare claims against historical behavior, and support more accurate payment review. Prior authorization is another major area of transformation. Today, prior authorization often creates frustration for providers, members, and payers because the process can be slow and document heavy. AI can help by extracting clinical information from submitted records, matching it to policy criteria, flagging incomplete requests, and routing cases to the right reviewer. Automation can support faster status updates and reduce avoidable back and forth communication. However, final decisions must remain transparent, clinically appropriate, and compliant with regulatory requirements. Member service is also changing. Members often contact health plans because they do not understand coverage, costs, claim status, provider networks, or next steps in care. AI-powered assistants can help answer common questions, summarize benefits, explain claim outcomes in simpler language, and guide members to appropriate resources. The goal should be better navigation, not generic chatbot responses. Sensitive issues, complaints, appeals, and care-related concerns still require human escalation. Provider operations can benefit from AI and automation as well. Payers manage credentialing, network updates, contract configuration, payment disputes, authorization requests, and provider inquiries. These workflows often involve documents, forms, rules, and repeated status checks. Intelligent automation can reduce cycle times by validating provider data, identifying missing credentials, supporting contract setup, and improving communication. Better provider experience can also improve member access and reduce operational rework. Enrollment and eligibility are strong candidates for automation because they involve structured data, defined rules, and high transaction volumes. AI can help detect mismatches, missing fields, duplicate records, and unusual changes. Automation can update member records, trigger verification steps, and reduce delays during onboarding or plan changes. Clean eligibility data is foundational because errors here can create downstream problems in claims, authorizations, billing, and member service. Risk adjustment and quality operations are another important area. Health plans need accurate clinical documentation and coding to understand member health status, support care programs, and meet program requirements. AI can help identify documentation gaps, organize clinical records, and prioritize reviews. But this must be handled carefully. AI should support accuracy and compliance, not encourage inappropriate coding or unsupported conclusions. Fraud, waste, and abuse detection is one of the most mature AI use cases in payer operations. Traditional rule-based systems can catch known patterns, but AI can identify emerging anomalies across claims, providers, services, geographies, and member histories. It can help investigators prioritize cases with stronger signals. Still, AI findings should be treated as leads, not proof. Human review, Due process and explainable reasoning are essential. Generative AI is creating new possibilities in payer operations. It can summarize long documents, draft letters, support call center agents, generate internal knowledge responses, compare policy language, and create clearer explanations for members and providers. But generative AI also introduces risks such as hallucinations, privacy exposure, biased outputs, and overconfidence. For payer use, generative AI should be grounded in improved content, monitored, and restricted from making final coverage or clinical decisions without appropriate controls. The risks are real. AI can amplify bias if training data reflects historical inequities. It can create unfair outcomes if models are not tested across populations. It can make opaque recommendations that are difficult to explain. It can also introduce cybersecurity and privacy risks if sensitive health information is not protected. In healthcare, speed is valuable, but trust is more valuable. A fast, wrong decision can harm members, providers, and the payer's reputation. Governance is the foundation for responsible adoption. Payers need clear policies for model selection, validation, monitoring, data use, vendor oversight, security, auditability, and human review. Teams should know which AI tools are allowed, what data they can access, what decisions they can support, and where human approval is required. Responsible AI is not only a technology issue, it is an operating model issue. Data quality is often the hidden challenge. AI performs poorly when data is incomplete, inconsistent, outdated, or trapped across disconnected systems. Pairs need strong data governance, interoperability standards, master data management, and clear definitions for key business concepts. Without reliable data, automation can simply move bad information faster. The smartest AI strategy starts with data discipline. Integration with legacy systems is another practical barrier. Many payer organizations operate on older core administration platforms, separate claim systems, document repositories, call center tools, and analytics environments. AI and automation must fit into these workflows without creating more complexity. The best implementations usually start with targeted use cases, measurable outcomes, and controlled pilots before scaling across the enterprise. Workforce impact must be handled thoughtfully. AI will change jobs, but it does not remove the need for domain experts. Claims specialists, nurses, auditors, analysts, compliance teams, and service representatives will still be needed to interpret context, manage exceptions, handle sensitive cases, and improve processes. Organizations should invest in training so employees understand how to use AI tools, question outputs, and work alongside automated systems. The strongest payer use cases usually share three traits. First, they address a real pain point with measurable cost, quality, speed, or experience impact. Second, they use data that is available and reliable enough for the task. Third, they include governance, human oversight, and monitoring from the beginning. AI projects fail when they begin as technology experiments without operational ownership. A practical roadmap starts with prioritization. Payers can assess use cases by value, risk, feasibility, data readiness, regulatory sensitivity, and member impact. Low-risk automation may begin with document routing, call summarization, knowledge search, and administrative task management. Higher-risk areas, such as medical necessity review, payment integrity, and appeals, require stronger validation, explainability, and oversight. The future of payer operations will likely be hybrid. Some tasks will be fully automated, some will be AI-assisted. Some will remain human-led because they involve clinical judgment, ethical considerations, disputes, or member vulnerability. The winning model is not full automation everywhere. The winning model is intelligent operations where technology handles scale and humans handle judgment. In the end, AI and automation can help payers reduce administrative burden, improve member and provider experience, strengthen compliance, and make operations more resilient. But success depends on using these tools responsibly. The goal should be faster processes, fairer decisions, clearer communication, and better healthcare administration. Thank you for watching.